Hometown Radio, KGAF. It is 7:46 here on this Thursday morning. We have a special guest in the studio today. Dr. Anwar is with us today, and we want to talk a little bit about something relatively new for you. You've got kind of a new home base beginning next week. You're going to be practicing at Muenster Memorial Hospital's clinic. Tell us a little bit about that and what brought this on.
Okay, Dee, thank you very much for having me on the air. I was Texoma hospital employee, and they decided to leave this market, so I have moved to Muenster. Unfortunately, my existing patients, did not receive a letter about the move, or there was an ad from, neither there was an ad from the Texoma. So I thought I'll come on air and contact my patient directly, which I always love. Mm-hmm. And Muenster is not new for me, actually.
No, you've been there a little while.
I was there between 83 when I first moved to Gainesville, and I worked there fairly actively, seeing consults and reading their echoes till 1995 or 96, when I became a rural health clinic and got too busy. Mm-hmm. So now I go back to Muenster, and it looks very, very familiar, and I love it there so far. We have not started seeing our first patient, but we are already almost full for our visits.
Yeah.
So we're going to be introducing some more things there from cardiac point of view. I'm a board-certified cardiologist and internist, so we'll be doing echoes and nuclear stress test and regular stress test there now very regularly. And, of course, I'll be available there. We luckily or unluckily do not have a hospitalist system in Muenster Hospital. So I will be admitting my patients, and I'll be seeing them on a daily basis. And so I think it will be much better for my patient, because there will be a continuity of care.
Yeah, that's great. And it's been a while since you've actually done that, so that'll be kind of like bringing back old times a little bit.
I love the hospital medicine.
Yeah, I know you do. And let's talk about the fact most people consider you a cardiologist, but you're an internist as well, and your practice in Muenster will cover the whole gamut, won't it?
It definitely do. I love internal medicine. I've always done probably maybe 60-40 cardiology and internal medicine. I love diabetes treatment. I've lot of family history of diabetes. I have some diabetes, so I keep up with the diabetes all the time. And to boot, diabetes is one of the important causes of heart disease, coronary artery disease. Mm-hmm. So when I see a diabetic, I'm actually seeing a potential or actual heart patients most of the time.
Mm-hmm. Yeah, you've told me that, because you treat me for diabetes as well, and I think I want to spend a little time talking about diabetes, because
sure.
I don't think people really realize. They may hear it, but they don't really take it seriously. What other health problems diabetes can lead to? It's amazing.
It's from head to toe. See, diabetes causes all its complications by damaging our blood vessels. Mm-hmm. The high sugar and other things which are going on metabolically make our blood a little more toxic to our own blood vessels. So since blood vessels are everywhere, the damage is everywhere. Let's say diabetic retinopathy is the commonest cause of blindness in our country. Diabetic nephropathy or kidney problem is the commonest cause of dialysis. Mm-hmm. Diabetes with vascular disease is the single commonest cause of amputation. And of course, diabetic, according to our big authority, American College of Cardiology, doctors are supposed to look at diabetes as coronary equivalent. What does that mean is, you assume a diabetic has already developed atherosclerosis or vascular disease in the heart, mm-hmm. unless proven otherwise. So it's unfortunately, and as you know, it's getting more and more common. At one time when I started my residency, about 6 to 8% of the adult population had diabetes. Now that number is closing on to almost 25-30%.
Mm-hmm. And the scary part of it is, to me, we have those type 1 diabetics that are born with it or get it as a child. Type 2 is it's amazing how it has just multiplied over the years.
90% of the diabetics have type 2, like adult. We used to call it adult onset diabetes.
Mm-hmm.
Unfortunately, we are seeing young people in their early 20s. I have a nephew who is a type 2 diabetic. He's very overweight, unfortunately. So the age of onset has come earlier and earlier.
Mm-hmm.
I remember when I was a medical student, type 2 diabetes was a disease of middle age, like 40 plus.
Mm-hmm.
And it is still very predominantly in that age group, but every year I see several people who are under 30, and we have to start them on diabetes medicine. Of course, I advise them to eat right and everything else, which is more important most of the time than the pills.
Mm-hmm.
And we keep getting new pills for diabetes.
Mm-hmm.
And all of them have multiple, one or the other side effects which can be serious. So please nobody should be stopping their diabetes medicines at this time, but it's always better to watch diet, lose weight, and use the minimum amount of diabetes medicine. As you know, we follow hemoglobin A1C.
Mm-hmm.
That is the key. Try to keep it around 7. That means your diabetes is fully controlled, and all those dreaded complications of diabetes become less and less and less probable as you control the diabetes well by watching your hemoglobin A1C.
And it's crazy how what is best for you treatment-wise is the hardest to do. Taking the pills isn't that hard. Boy, losing that weight and eating right, that's the difficult part.
That's the difficult part. And the problem is that diabetes is like killing you slowly. And on a day-to-day basis, you don't feel bad. It's just like slow poisoning by arsenic,
mm-hmm. It's amazing. Mm-hmm. Yeah, it just slowly but surely does it. All right, again, we want to remind folks, if you're a patient of Dr. Anwar's and have been here in Gainesville, he will be practicing at Muenster at the MMH Family Health Clinic. That's at 509 North Maple, right next door to Muenster Memorial Hospital, beginning next Monday, already taking appointments. His number there will be 940-759-2226. And I know the folks at the hospital are excited to have you, and you seem to me to be very excited to be there.
Medicine is not a profession for me, D. Medicine is my passion and a mission. So I like it, so I don't think I'll ever retire.
Well, and the best doctors don't. That's what I say.
That's so nice of you, D. I really appreciate the kind words.
Well, and it's the reason that as soon as you came back here, I got back with you because I just never got the care I felt like anywhere else that I get from you.
Well, that's so nice of you, and I try. To me, every patient is my special patient.
Mm-hmm. Yeah, and that shows. That shows through. I've heard you talking to other patients when I'm in the office, and you're friends, but you really care about them too, and that's great as a doctor. Dr. Anwar, thank you very much, and I'll be making my appointment very soon.
Thank you very much, Dee. Have a great day.
You too. Thanks so much. He is Dr. Khawaja Anwar, and